two kidneys. These are the adrenal glands, of course. Here we see the adrenal cortex out here, and here's the medullary tissue. Here they brought out some renal pyramids. Here's a renal column, which again is an ingrowth of the cortex over here. We can see some of the collecting ducts and other things coming down over here. This, of course, is cut into the renal pelvis. We see at the renal papilla here a minor calyx. Here's a minor calyx at the end of this one, a minor calyx at the end of this one, and these are all dumping into this bigger area here, which is called the major calyx, and the major calyx is dumping into the renal pelvis. Our ureter coming down. This, of course, is the trigone we talked about before, and this, of course, is a male because we see the prostate gland here. So we call this part of the urethra the prostatic urethra. And again, this is problematic with males because a lot of males, when they get older, we have benign prostatic hypertrophy, which means it gets bigger and it pushes on the urethra here and it closes it down, and this is a problem. So we can either give a medication that helps to reduce the size of the prostate gland. If urine starts backing up, we have to send a catheter up here to open this up. It's an issue. Males need to watch their diets and do things that are going to actually provide positive prostatic health. The benign prostatic hypertrophy is not a fate that can play. It's controllable, but you have to watch what you're doing. These right here, by the way, are the vas deferens. This is a male, so all of a sudden now we see these structures back here called the seminal vesicles, and we're going to learn about those. Maybe you can talk a little bit about it later today, or wait for next week. Seminal vesicles, of course, are going to contribute to the formation of semen, and we can't see it here, but the seminal vesicles are going to join with the vas deferens to form something called the ejaculatory duct, which we would see in here. And the ejaculatory duct would bring the sperm and seminal fluid, seminal vesicle fluid up here, and we would add prostatic fluid, and then the forming semen would come out here, and we'd add one more thing here, secretions from the Cowper's glands, and then we'd have our fluid-formed semen. But we'll look at some other things, but just note at this particular juncture that these are the vas deferens coming from the testicles, providing the sperm, the seminal glands here, which are going to form the seminal vesicles that are going to add some extra fluid, and the prostate, which are going to add some more fluid, and then we'll have one more contribution to the mess, the Cowper's gland. Over here,